Meet Bernice. She has COPD and she desperately needs a new set of lungs. She scoured every catalog on the planet in search of her dream lungs. And one day, she finally found them. She calls her favorite transplant surgeon to get the 411 on the latest and greatest in lung replacements. Dr. Fonzaldua has the perfect solution and is ready to meet with Bernice immediately. I don't want no stupid lungs, you hear? I got 2 stupid ones as it be.
Damn, there's no such thing as stupid lungs. Get on down here already.
Really? Right now? You betcha. I'll be right there. So today we're going to be talking about lung transplants, life before and after the surgery. Speakers today are going to include Jordan Basaldua, Beverly Ham, Lou Fonseca, and myself, Tara Stone. Our presentation will be broken down into 2 parts, before and after the surgery. The before part will consist of requirements needed to get on the list and stay on the list. It will include where in Texas the surgery is performed, the cost of the surgery, how much does insurance pay, and financial support. We'll also tell you about preparations needed for surgery, risks of surgery, and the importance of support of your family, friends, and other support groups. After the surgery, we'll talk about recovery in the hospital, what types of medication will be needed and for how long, recovery at home, lifespan after lung transport, and we'll talk some more about the importance of support from family, friends, and other support groups.
When a patient has failed all possible medical therapies available to them and are at a high risk of death in 1 to 2 years, or if a person has a poor quality of life, they may be considered for a lung transplant. A few illnesses that can qualify a patient for a lung transplant are COPD, cystic fibrosis, alpha-1 antitrypsin deficiency, hypersensitivity, pneumonitis, and primary pulmonary hypertension. To be put on a transplant list, patients must first be referred to a transplant team by their doctor. Patients must be prepared to give a brief medical history with results from pulmonary function studies, CT scans, and chest x-rays that were performed in the last year, along with insurance information for the team to review. If the team feels that you qualify for a transplant, you will be scheduled for a pre-transplant evaluation, which will include a series of tests, a complete physical, and meetings with members of the transplant team. This meeting will include a financial coordinator and social workers. After this, there is also a lung transplant evaluation to be done in which blood will be drawn and blood and tissue typing will be done along with other blood tests to evaluate general health and substances in the blood. Not everyone is a candidate for lung transplant surgery. If a patient has active cancer, hepatitis B or C with cirrhosis, or HIV infection, they will not be qualified. Current substance abuse of tobacco, alcohol, and illicit drugs will also prevent a patient from getting on the transplant list. If it should turn out that you need a lung transplant, you might say, where in Texas should I go to get a lung transplant? Lung transplants are not very common, so not all hospitals perform this surgery. Since a lung transplant team consists of a thoracic surgeon, pulmonologist, cardiologist, immunologist, respiratory technicians, and transplant coordinators, a patient will most likely have to travel to a big hospital in the metropolitan area. Texas Children's Hospital in Houston deals with pediatric transplant. University Health System in San Antonio, Baylor University Medical Center in Dallas, St. Luke's Episcopal Health System in Houston are a few of the hospitals that perform lung transplants.
Here we have an estimated cost for a single lung transplant, which can range anywhere from $200,000 to $400,000, and that is again for a single lung only. Cost would be doubled if our patient needed both lungs replaced. Some important questions that you should consider asking your insurance provider include: what part of the transplant procedure is actually covered? What happens if my financial coverage runs out? How much is then coming out of my own pocket after my cap amount has been met? You also should consider whether or not all your premiums have been paid and are up to date. If you have any missed premium payments, your insurance could be revoked and they can deny covering any expense since you missed your payments. So it's again very important to stay up to date on your premiums and make those payments on time. Also, it would be important to find out what diagnostic tests are covered by your insurance before and after your surgery. Having a full understanding of the scope of your coverage that your insurance is willing to cover, and provide is pretty essential. Of course, we have to know our copay as well as our deductible, and whether or not any assistive breathing devices will be included in our coverage.
When a patient gets into the medical center's transplant program, they are placed on the Organ Procurement and Transplantation Network's national waiting list. The wait for a donor lung might be filled with frustration while waiting for a suitable donor. The wait can be anywhere from a few days to over 6 months. The organ recipient and the donor must have compatible blood types and similar body sizes. To help prepare for surgery, go to all medical appointments with the transplant team, take all medicines as prescribed, stay as healthy as possible, and don't smoke, and keep your suitcase packed and be ready to go at all times. You may even be asked to carry a pager. Once a donor lung is removed, it is taken to the recipient's transplant center, and surgery will take place in a matter of hours.
Risks. As far as risks, with any invasive procedure, there's always going to be, it's always going to have its, set of risks and complications. And to kind of, put that into perspective a little bit more, talk about a couple percentages survival-wise. Okay, about 78% of patients survive the first year after their surgery. About 63% of patients survive after the first 3 years, and about 51% of patients survive after 5 years of surgery. So it's a pretty intense surgery, and it does come with its fair share of risks. One of the biggest complications involved in lung transplantation is the potential that the new tissue introduced may be rejected and the body won't accept it as its own. Some of the signs and symptoms of rejection, you can have a fever or flu type symptoms, chest congestion, coughing, dyspnea, pain around the new lung, or just overall not feeling well. Okay, some more complications include infection and the potential for long-term use of immune system suppressing medications. Now, since facing the reality of a serious illness involves a lot of fear and it's a scary situation for someone to be in, and since you're riddled with new and unfamiliar complex medical information, this whole situation can seem really overwhelming. And to help with that, we look to support groups for help, and of course we have the obvious ones, friends and family, but then also we have home care agencies as well as hospice who can aid in additional support. Another good source of support may come from people that have been in similar situations, people who went through really invasive surgeries like lung transplants. Sometimes they can give additional support and advice that you can use. Sometimes they can explain things a little bit differently than your healthcare provider might. Also, we have, like I said, we have home care assistance, which involves a representative from a home care agency that can meet with you and your family members to discuss home care options, which includes visiting nurse, home health aide, physical or occupational therapist, and some insurance companies even cover these expenses.
Okay, hospice is another service available for more intensive care, or when more intensive care is needed. Hospice offers nursing services, home health aides, social work services, and even pastoral care.